Hi everyone, welcome back to my YouTube channel, and today we are going to talk about zygomatic bone. At the side of the lecture video, you can see the diagrammatic representation of the skull and the purple color bone or the pinkish purple color bone at the side is the zygomatic bone. Talking about its introduction, zygomatic bone is one of the most prominent facial bones that not only contributes to facial beauty but also serves important protective and functional roles. By establishing the control of mid-face and influence how the eyes are positioned and assist in sustaining the forms and balance of facial skeleton. The detailed exploration is essential for professionals in fields such as maxillofacial surgery, orthodontics, radiology, and forensic science. Now let's talk about location and shape of zygomatic bone. It is situated at the lateral aspect of mid-face. Zygomatic bone is the paired structure that forms the prominence of the cheeks. It is positioned between the maxilla medially and the temporal bone superiorly. The bone has an arched curved shape that contributes to the overall contour of the face. Now talking about its articulation, zygomatic bone contributes to multiple structural junctions. As with the maxilla, it first forms the anterior part of zygomatico-maxillary complex. It articulates with the frontal bone, contributing to the lateral margin of the orbit. It also joins with the sphenoid bone and temporal bone, forming the zygomatic arch, which is significant for both structural integrity and muscle attachment. Now let's talk about features of zygomatic bone. The bone exhibits several important surface features. The first is infraorbital margin, which helps form the lower rim of the orbital cavity. Second feature is temporal process, which extends posteriorly to connect with the temporal bone and forms part of zygomatic arch. The next feature is orbital surface, which pair adjacent bones to shape and protect the eye socket. Now let's talk about development and ossification of this zygomatic bone. Embryological formation. The zygomatic bone develops through the intramembranous ossification, that is the process in which mesenchymal cells differentiate directly into bone without a cartilage precursor. This method of ossification is characteristic of the flat bones of skull, ensuring that the zygomatic bone forms in a manner correlated with the rapid growth and expansion of the facial skeleton during early years of life. Then we will talk about postnatal growth and maturation of zygomatic bone. During childhood, the zygomatic bone undergoes significant growth as the facial skeleton matures. The suture between the zygomatic bone and its adjacent structures such as the maxilla and temporal bone remain open to accommodate this development. Gradual ossification and suture fusion mark the transition from a flexible growing stage into a sturdy, mature bone that maintains facial structures. Now let's talk about functional significance of zygomatic bone. The first functional significance is aesthetic and structural contribution. Facial control. The zygomatic bone is integral to the facial aesthetic, contributing to the prominence of cheeks and the overall symmetry of the mid-face. Its curvature and position help define an individual's facial appearance. Second is by orbital support. As by forming part of lateral wall and floor of the orbit, the zygomatic bone helps protect the eyes and facilitate proper alignment of the orthocular structure. And that's how it helps in static and structural contribution. The next functional significance of zygomatic bone is its muscle attachment and masticatory function. Attachment site. Zygomatic bone serves as an anchoring point for several muscles involved in facial expression and mastications. For instance, parts of masseter muscle attached to the zygomatic arch playing a pivotal role in chewing and jaw movements. Second significance here is mechanical leverage, as its robust structure contributes to the distribution of forces during mastication, helping maintain the integrity of the facial skeleton during dynamic movements. Now let's talk about clinical significance of zygomatic bone. The first is fractures and trauma. Zygomatico-maxillary complex fracture. Due to its exposed location, the zygomatic bone is particularly vulnerable to trauma, such as from blunt force injuries or facial accidents. Fracture in this region may involve not only the zygomatic bone itself but also the surrounding maxilla, temporal bone, orbital floor, leading to complex reconstructive challenges. Second, clinical significance is surgical intervention, as successful treatment of zygomatic fracture often require a multidisciplinary approach employing detailed imaging studies such as CT scan to map the fracture line. Surgical reconstruction aims to restore both the functional and aesthetic part of the midface. Second, clinical significance is aesthetic relevance in reconstructive surgery. Facial contouring procedure. In cosmetic and reconstructive surgery, understanding the anatomy of zygomatic bone is crucial for procedures such as malar augmentation and facial implant placement. Detailed anatomical knowledge helps surgeons optimize facial balance and symmetry. Second is the forensic and anthropological studies. As the morphology of zygomatic bone can provide insight into age, sex, and even ancestral background, forensic experts often access the zygomatic region as part of craniofacial examination during identification. Now let's talk about conclusion of whole of this lecture video. Zygomatic bone is critical component of facial skeleton influencing both the aesthetic and the functional aspect of the mid-face. Its role in forming the contour of cheeks, supporting the orbits, and contributing to mastication underscore its multifacial significance. A detailed understanding of its anatomy, developmental processes, and clinical implications is indispensable for clinicians and sisters alike, enabling effective management of facial trauma and enhancing the outcome of reconstructive and cosmetic intervention. And this was all about zygomatic bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.